Polycystic ovary syndrome is a condition that causes irregular menstrual periods and is one of the most common causes of female infertility, affecting 6 to 12%, as many as 5 million of US women of reproductive age group. In today's video, I'm going to tell you what is PCOS and what are the common signs and symptoms. Welcome to another episode of Dr. Says. The cause for PCOS is not completely understood. In women with PCOS, multiple small follicles accumulate in the ovaries. None of these small follicles are capable of growing to a size that would trigger ovulation. As a result, the levels of estrogen, progesterone, LH, and FSH, which are crucial for maintaining a normal menstrual cycle, become imbalanced. PCOS is associated with elevated levels of insulin in the blood. Excess production of insulin is called hyperinsulinemia. Insulin is a hormone that is produced by specialized cells within the pancreas, and insulin regulates blood glucose levels. When increased levels of insulin are required to maintain a normal glucose levels, a person is said to be insulin resistant. Insulin resistance and hyperinsulinemia can occur in both normal weight and overweight women, although PCOS does tend to occur in more patients who are overweight or obese. Besides, if you have a mother or a sister who has been diagnosed with PCOS, the chances of you getting it is quite high, as studies have found it to be genetically inherited. The signs and symptoms of PCOS usually begins around the time of puberty, although some women do not develop symptoms until late adolescence or even into early adulthood. The most common symptoms of PCOS is menstrual irregularity. Because ovulation does not occur in PCOS, the lining of the uterus, also called the endometrium, does not uniformly shed and regrow as in a normal menstrual cycle. Instead, the endometrium becomes thicker and may shed irregularly, which can result in heavy or prolonged bleeding. Irregular or absent menstrual periods can increase a woman's risk of endometrial overgrowth or even endometrial cancer. Women with PCOS usually have fewer than 6 to 8 menstrual periods per year. Next, weight gain and obesity. PCOS is associated with gradual weight gain and obesity in approximately one half of women. For some women with PCOS, obesity develops at the time of puberty. Many of them will also experience male pattern hair growth, or known as hirsutism, and may be seen on the upper lip, chin, neck, sideburn area, chest, upper or lower abdomen, upper arms, and inner thighs. Acne is also commonly seen as male hormones known as androgen is usually raised in PCOS. Next up, infertility. Many women with PCOS do not ovulate regularly, and it may take these women longer to become pregnant. If a woman with PCOS has irregular periods, their fertility evaluation should start immediately, as the chances of becoming pregnant is low without treatment. Next, heart disease. Women who are obese and who also have insulin resistance or diabetes might have an increased risk of coronary artery disease, which increases the risk of having a heart attack. And finally, sleep apnea. Sleep apnea is a condition that causes brief spells where breathing stops during sleep. Patients with this problem often experience fatigue and daytime sleepiness. In addition, there is evidence that people with untreated sleep apnea have an increased risk of insulin resistance, obesity, diabetes, and cardiovascular problems. Besides those major symptoms which I have already mentioned, women with PCOS are also at increased risk of developing other problems that may impact their quality of life, and this includes depression and anxiety, sexual dysfunction whereby they are more likely to experience lower sexual satisfaction, and eating disorders including bulimia and binge eating. So there you have it, guys. Stay tuned for the next video where I'll talk about how doctors diagnose and treat PCOS. Thank you for subscribing, and I'll see you next week.